Hi everybody, this is Dr. Mehmet Doğru from Elit Dental Clinic, Turkey. Today I talk about zirconia crown treatment and zirconia crowns production process step by step. If you are planning to have this treatment in Turkey, please watch this video until the end. When our patient first comes to the clinic, we collect all information we can. We take a panoramic X-ray, we take photos of patient's profile and intraoral, and also we digitally scan the existing teeth. So we collect all information and discuss with the patient his expectations, the color, the shape, the size, etc. Then we start the surgery part. It generally takes 1 or 2 hours under local anesthesia, and when the surgery finishes, we immediately take the teeth impression again with an intraoral scanner and send the data to the design department. And we make the teeth design up to patient's expectations. In this case, our patient wanted us to close the gaps between his teeth, and he wants to keep the size of his teeth, the height of his teeth with the original size. So depending on his expectations, we made the design. Also, we find the most suitable shape from the design library of our design software. After the design finished, we have two options. Mostly clinics discuss the shape and design on a large screen TV and expect patients to accept design over this image. But as a dentist, it doesn't sound right. Maybe just for a few teeth it can be done, but for a complete smile makeover, it would be better to check it in the mouth. So in order to do it, we use a 3D printer and print the final restorations copies from this printer, and we create a mock-up. We invite our patient on the second day and check this mock-up plastic teeth in his mouth. So we have a chance to see the bite, the sizes, the relation of the teeth at the different bites, and we also check the soft tissue, lips, everything. And patient also has a chance to see how teeth will seem at the final, and we make corrections at this stage, and if a change needed, we update the design and produce the final crowns up to this final design. At this case, we didn't have many problems. We liked the design, our patient liked also, but we only want to make small change, small adjustments, and we applied on the design software and go to the next step. The next step is miling the crowns from a zirconia block. Here, the most important part is starting. The color selection is very important. Our patient picked this color, BL2. This is the Ivoclar color shade guide, and it has 4 bleach colors. And our patient picked this BL2 color. The shade guide and the restoration material must be, if it's possible, the same brand. And we use the same brand zirconia and same shade guide in order to not to have any problem at the final. If you are having a trouble about you picked a color, but when the restorations to the crowns, veneers arrived, these are not exactly what you picked, it's probably because of this mistake. Then we picked the we have the design, we have the color code, everything. Now it's time to pick the zirconia block. In our clinic we use Ivoclar emaxprime zirconia blocks. And maybe you see it's written BL2. These blocks has in many different color shades, and depending on the patient's color choice, we pick the suitable zirconia block. This zirconia block, in my opinion, the world's best and quality zirconia block. It is made in Germany by Ivoclar company, which is a leading company in restorative dentistry. This block has an advantage also. It's called gradient technology. Gradient technology means it combines the high strength zirconia with the high translucent zirconia in the same block. When it is high strength, it doesn't have a good translucency level. So when we are making crowns from this block, we can put translucency on the cutting edges of the crowns, veneers, and we can make the rest of the teeth from the high strength part of the block. So we combine strength and aesthetic at the same block. And then we continue with the milling process. The crowns are milled, and we gently remove the milled crowns from the blocks. Now it's time to put them into a sintering furnace. Sintering furnace is so important process. It may take up to 9 hours, and sometimes it goes up to 1500 Celsius degrees in this furnace. Our block, this emaxprime blocks, has a special sintering program. So we pick we don't want to take any risk, and because of that we choose the same brand of sintering furnace, and this furnace has a special program, and we sure that the crowns are sintered at the right process under the right degree and time. Generally, if I see that third-party Chinese-made blocks which even don't have a CE certificate are used for the zirconia crown production, and these third-party blocks are an unknown product for this sintering furnace. So a common program is used, and generally some cracks or micro cracks happens, and this affects the long-term success of the treatment. After the sintering process finish, it's time to glaze these crowns. We use generally Ivoclar glaze paste, which has a fluorescence effect inside. The fluorescence is very important because the normal glaze doesn't have this fluorescence effect, and zirconia material needs some fluorescence because it is not exactly a porcelain. So we should use this special glaze in order to have shiny crowns at the end. Now it's time for cementation. We invite our patient to the clinic on the 3rd day, and we check crowns one by one. Because we have already tried the shape previous day, so we only check the color, and the color is also definitely match with the color code, and we cement these crowns permanently. So as you see, this is how we prepare teeth, design them, produce them, and finalize the treatment in our clinic. This is how the digital workflow continues. I hope you enjoyed the video. Thank you for watching me. See you next time.